Dawn breaks over Cairo. It's quiet up on the hospital rooftop. Just me, my black tea, and the distant call to prayer drifting through the air. I take a deep breath, bracing myself for another day at Abu El-Rish Children's Hospital. Every sunrise brings new faces, new fears, and always the same silent question in every mother's eyes: will my child survive? Late morning, the emergency room. In walks a family who look like they've carried their whole world on the bus. There's Heba, the mother, cradling her 12-month-old son Youssef. He's so tiny it hurts to look. His father, Mahmoud, stands close, his work clothes covered in dust. And there's Samiha, the grandmother. She's loud, prideful, and maybe a little scared too. Heba's voice trembles. He hasn't fed well since 6 months. He's shrinking, so weak. Before I can answer, Samiha jumps in. In our days, we fed babies bread and milk, and they turned out fine. You all worry too much. I try to reassure them. This isn't about blame. Youssef needs urgent care. Let's focus on helping him now. 30 minutes later, in the exam room, I see just how fragile Youssef is. His ribs poke through his skin, his little legs have lost almost all their fat. I chart his growth and my heart sinks. He's slipping off the curve. I whisper to my assistant, his weight curve is crashing. There's clear muscle loss. It's not just numbers on a page, it's a life in danger. Under the harsh lab lights, we dig for answers. Dr. Tarek, our hematologist, rattles off the results. Hemoglobin is low, iron is very low, celiac screen is negative, thyroid normal. Everything points to one thing: failure to thrive. Not a fancy diagnosis, just a brutal reality. Down the corridor, I find Heba in the prayer room, forehead pressed to the carpet, silently begging. Mahmoud sits beside her, eyes red, and even Samiha is quiet. I kneel beside them. We'll start nutritional therapy and iron supplements. Weekly follow-ups are vital. Heba's voice cracks. Is it my fault? Did I cause this? I look her in the eyes. You did your best. Now it's our turn to help him thrive. A week later in the nutrition clinic, Dr. Layla lays out a plan. Calorie-dense meals, iron-rich foods, weekly check-ins. Heba listens closely, hope flickering in her eyes. Tell me what to cook. I'll do anything every day. 1 month after that first fearful morning, I find myself back on the rooftop at sunset. Cairo's skyline glows gold, and just below me, Youssef, chubby-cheeked, sparkling eyes, giggles as he tries to crawl. Heba laughs with him, her face transformed. I feel tears prick my eyes. Sometimes the longest journey begins in a mother's lap, and the greatest victory is seeing a child smile again.